Welcome, everyone. My name is Judy Barton, and I am the Director of Operations for Healthcare for All Minnesota. We welcome you to tonight's webinar. It is our summer update where we'll review the recent legislative session and then also discuss what Healthcare for All Minnesota and Physicians for National Health Program Minnesota have planned this summer in terms of outreach activity to spread the word about single payer here in Minnesota. There's some exciting things going on. And just a couple housekeeping items. First off, this meeting is being recorded. The link will be sent out to you once it's uploaded to YouTube sometime early next week. Also, we will send out all of the slides that are presented today. So please know that that's coming to, again, sometime early next week. Those all come in one email together. If you have any questions, we ask that you please hold them until the Q&A section, at which time you will use the raise your hand feature. That is in your toolbar, your Zoom toolbar at the bottom of your screen under reactions, which is a little smiley face. If you click on that, there'll be something that says raise hand, and please click there. This just ensures that we don't overlook any questions. If you have any technical questions, please put them in the chat, and either Jen Crawford from PNHP Minnesota or myself will help you. And with that, I'm going to hand it over to Ann Jones. Ann?
Thank you, Judy. Welcome everyone to our Healthcare for All Minnesota and Physicians for a National Health Program Minnesota quarterly meeting and summer update. Thanks to Judy and Jen for hosting this evening. And I am Ann Jones, retired registered nurse and vice chair of Healthcare for All Minnesota. Our presenters this evening are Judy Barton, Director of Operations for Healthcare for All Minnesota, Jen Crawford, Executive Director for Physicians for a National Health Program, Roach, our chair of the board of Healthcare for All Minnesota, and then me. We will hear a welcome from our board chair first, and then we're going to hear from Judy, who will talk a little bit about fundraising to support the mission and some of our outreach activities for this summer. Get an update from Jen about PNHP Minnesota. And then the main part of our program this evening is a review of the just recently closed legislative session in the state of Minnesota on healthcare, health policy related legislation. I will then finish up with some announcements from our Education and Outreach Committee and a call to action, and then we'll have a wrap up. We'll be done for the evening. So go ahead. First on our agenda, we will hear from Roach, our board chair.
Thank you, Ann, and thank you everyone so much for being here tonight on this lovely June evening. Greetings of health and solidarity to everyone. So tonight's meeting, as Ann said, is centered pretty much on what is really an incredible 2023 legislative session, with the caveat and the exception of the fact that we didn't support our nurses and instead allowed corporate healthcare bullying to win against safe, responsible legislation that would have simply provided bedside nurses a voice when it comes to safe patient care. Not only will that fight continue, as the nurses will never give up on being the voice of their patients, but that fight makes it clear that what we're up against when it comes to this industry that looks to protect their profits over all else, including patients. Of all the workers for us to forsake, considering what they've been through these past 3 years, leaving our nurses behind is really quite shameful. I recently spoke at a DSA rally in the Capitol Rotunda about the need for passage of the Minnesota Health Plan. And I just want to share with you my opening remarks, because I think it sets the stage for our work going forward and our discussion here tonight. I began by saying, want to know what ails our so-called healthcare system in this country? Let's look at some recent headlines to see if they offer any insight into that question. So here are some headlines. These are real headlines from the news. Health insurers spent over $141 billion buying back their own shares since 2007, while premiums and deductibles have skyrocketed. Here's another one. Corporate giants buy up primary care practices at a rapid pace. State HMO profits jumped drastically. HMO profits from Minnesota state programs jumped to $675.8 million with enrollment surge. Inflation is failing, but your health premium may be about to soar. How big pharma actually spends its massive profits. New research shows that pharmaceutical companies have spent more on enriching shareholders than drug research and development over the past decade. Humana to exit the employer insurance business to focus on government plans. Quote, the exit from the commercial group business makes strategic sense as it enables the company to focus resources on Medicare Advantage business. Here's another one, big business or big insurance 2022 revenues reach 1.25 trillion thanks to sucking billions out of the pharmacy supply chain and taxpayers' pockets. Quote, we are still going to say no, unquote, inside United Healthcare's effort to deny coverage to chronically ill patient. Record high in the US put off medical care due to cost in 2022. Hospital consolidation increases disparities in health insurance coverage. Hospital consolidation and racial income health disparities in health insurance coverage. Retailers are buying up healthcare delivery. Doctors are disappearing from emergency rooms as hospitals look to cut costs. For private equity firms, dropping ER docs is a simple equation. They could have qualified for charity care, but Mayo Clinic sued them. And hot off the press over the last week, Alina cuts care for patients who owe. Doctors at $4 billion nonprofit are not allowed to see poor adults or children with too many unpaid medical bills. And just yesterday or the day before, Merck, a big pharmaceutical company, sues HHS over drug negotiation, claims program is tantamount to extortion. Can you imagine? This is what's going on. And it certainly doesn't sound to me like that is a medical industrial industry that is focused on our health so much as it is focused on their own wealth. But fortunately in Minnesota, we did at least accomplish a few important infrastructure building blocks towards healthcare justice. And I'm going to get into those particulars in a few minutes when I recap the 2023 session. I do want to take a minute to also provide an update on the restructuring, if you will, of Healthcare for All Minnesota itself. The HCA-MN board, along with key organizational volunteer leaders, met in April to spend a day together around an introspective review of HCA-MN, but to also think strategically on a broader level, and that's all about the need for a statewide campaign to win the Minnesota Health Plan. Internally, the board this morning it considered an organizational structure with accompanying tasks as was determined at the leadership planning meeting. And I want to note that I'm sharing this because you all are HCA-MN. And even though the board has not yet signed off, so this isn't anything finalized, I do think it is important to share with you all the terrific work that has been going on behind the scenes since our last quarterly meeting. So with that, we have got some committees that exist within the organization now. Here's kind of the structure we're thinking about going forward. There's an executive committee. They will be looking specifically at reviewing our governing documents, including a new mission statement that we drafted together that states that our mission is to establish a state-based universal single-payer health plan for Minnesota while actively supporting national Medicare for all. We're also working on a flow chart that is going to very specifically show you in a diagram, easy to look at, how the organization is structured, what various committees exist, and what are the roles and responsibilities of those committees, so you will have a really easy time figuring out which one you want to volunteer for. The executive committee will also be developing organizational policies related to staff and volunteers and making sure we're all working in a safe space together, developing welcoming documents for the health justice allies and our partner organizations, create a comprehensive board packet, and develop a more focused board recruitment process that includes a leadership mentoring program. The Legislative Policy Committee will look at tracking policy trends, drafting white papers when appropriate, Also track national and state legislation that builds infrastructure for the Minnesota Health Plan and Medicare for All, make recommendations on legislative endorsements to the Healthcare for All Minnesota Board, create annual lobbying plan for the Minnesota legislature, such as should we have an annual lobbying day. Also making sure that we are putting together alerts for our members and making sure we target them to the legislators that we need to get moving on certain pieces of legislation. And they will also build ongoing relationships with key legislators. A fundraising committee that will develop comprehensive ongoing fundraising mechanisms, create fundraising events, and calendar regular fundraising pitches. We're going to create an audience diversity and inclusion committee, and they will focus on engaging a diverse population of individuals and organizations in the campaign and the movement, making sure such things as materials are available in a multitude of languages, that all of our events include interpreters, and develop ideas for outreach to include events and communication modes for all of the different types of opportunities we have in the communities to talk about why healthcare justice is so important. An Education Speakers Bureau committee that will oversee educational materials that we already have developed, which are tons and really, really terrific work already went into that. Create new educational materials as needed, handle speaking, tabling, and education forum requests, and develop education events themselves specific to our partnership with PNHP on educational events. There'll be an outreach base building committee, which will incorporate some of the work that the Coalition Builders Committee has been doing. They'll be the conduit to the Minnesota Health Plan statewide campaign, and will continue to bring new organizations and volunteers into Healthcare for All Minnesota. And then a communications committee that will oversee social media platforms, develop internal newsletter for HCA-MN members, and handle all press, including press conferences and press releases. The first task of all of the committees is going to be to focus on creating a mission statement and define their responsibilities and tasks, choose a committee chair and secretary to take notes and to-dos, and to draft a one-year plan that identifies projects with established goals and timelines. And that's just the internal work that we're talking about doing. I will be noting in the legislative recap presentation the next steps for our work with the Health Justice Allies Coalition. And that's going to be all about bringing everyone together to get serious about a strategic, statewide, multi-year, multi-generational, multiracial campaign plan to win the Minnesota Health Plan and figure out the conditions we need to make that happen. We need organizational and personal commitments to politically prioritize passage and implementation of the Minnesota Health Plan, along with committed resources in order to win. And it's time that we make that happen. So lots going on, lots to think about, lots of opportunities to find volunteer areas that speak to your heart and or your head, and to be part of making history happen. This is our distributive organizing and distributive leadership model, because it takes a village. Healthcare justice isn't just a hope, it's a moral imperative, and it's up to each and every one of us to make it happen. So pick a committee and let's get to work together. Si se puede. Thanks, everyone.
Thank you so much, Rose. I'm exhausted already, but we have a plan. Judy, could you talk a little bit about raising the funds we need to support our work?
Happy to. So this is never the fun conversation to have, and it's not fun to be the person to have to ask it. But unfortunately, somebody's got to do it, and so it's my job. We are really excited about the summer. First off, we have a lot planning going on in terms of our events outreach events that we will be doing. First off, we will be continuing doing Twin Cities Pride, Farm Fest, and the Minnesota State Fair, all of which we did last year. They were all super fun. And we also connected with so many individuals at those events. So we feel like it's really worth the effort to do those events. All of those events, though, require lots of volunteers. So if you would like to volunteer for an event this summer, please email us at info@hca-mn. That email goes directly to me, and I will help sign you up for one of our summer outreach events. We have more than one event, or more than just these 3 events too. We are also doing several Juneteenth events coming up. I know that they're doing one in Woodbury where I live. And where are the other ones for Juneteenth? Do you remember?
In North Minneapolis and
Okay.
Maple Grove,
Okay.
and I believe outstate as well. I
Yes.
hope I'm not missing
I
something.
think in Mankato they're
At
doing it.
Mankato, yes.
Yeah.
We have.
We also, as Ann stated, we are having some outstate events that we'll be doing. Our chapter in Mankato is doing a lot of outreach events this summer, as well as there's several up in Duluth. So if you're in one of those 2 areas, we can get you connected with our members up there to help out. We also have, Ann will be going to do with, it's Red Lake County and Polk County, correct? Polk
Yeah, I've
County.
got that on my announcement.
So, we're really excited about reaching out to the outstate and, telling those in the outstate that yes, we care about the entire state of Minnesota, not just the Twin Cities. So if you're in one of those areas, or if you know of an event somewhere that you think we should be at, please, please, please let us know. You again can email us at info@hca-mn. But with all of these events come costs. So, the things we have to cover are booth and table registration fees, the lovely buttons that we hand out to people, maybe some small prizes for a Wheel of Misfortune, printing of brochures and other materials, travel expenses, especially for those greater Minnesota outreach, the outstate events like Farm Fest, because Farm Fest is 3 days, and so we have to book some hotel rooms and such. Entrance fees for volunteers, that's specific for the Minnesota State Fair. They do not let their volunteers in for free. You have to pay every day you go. We have to have liability insurance for a lot of these. Some of them have Wi-Fi fees that we may have to pay for. So just know that there's a lot of expenses that come along with this. And if you have the ability to donate to us, we would greatly appreciate it. We last year at Twin Cities Pride, we had printed 500 buttons. Those were gone in the first 6 hours. So we're tripling the number we order this year for those buttons. And then we need buttons for all of those outstate events, and then Farm Fest and the State Fair, as well as all of those little tabling events that we'll be doing throughout the entire summer. Jen put into the chat for me the link to donate. This will go directly to those summer outreach events. So again, please consider doing that, and we would greatly appreciate it. Thanks.
Thanks, Judy. Appreciate it.
Did I cover everything, Ann?
I think so. We've got, I just want to mention, we've got terrific people in Greater Minnesota working on getting tabling at our county fairs. And those require registration fees and support for materials as well. So these are the really important things we need to do. We need to really do the organizing, building our base of support, and getting the numbers we need to build up our political will for change. So appreciate anything all of you can do. And then Jen, would you like to give us an update on positions for a National Health Program Minnesota?
I would be happy to. Thank you, Ann. It is so great to see so many great names and faces tonight, especially with our partnering organizations from across the state. Hello and welcome. So I am Jen Crawford. I work with Physicians for a National Health Program, the Minnesota chapter. So we are a national program of healthcare workers from across the country that are fighting for single payer healthcare financing reform. I have good news to share tonight. I don't feel like I get to share good news very often. I'm going to hold on to it. Haha. So we have important work that we do all year, reaching out to the healthcare professional and trying to inform them about single payer and get them to join us in our advocacy efforts. Our most important work actually happens every summer in our summer internship program. And that's when we have rising second year medical students and some public health graduate students that join us for 7 weeks for an internship program where they learn the basics of single payer. They speak with local and national advocates. They learn advocacy techniques. They do independent projects, and they get a great base foundation for organizing in their futures. Last year, we had an exceptional group. I feel like I say that every year, but they were truly exceptional, I believe. And the students that came out of last year's program had quite the year. And I just wanted to hit the highlights of some of those, just so you know the outcome, the fruits of our efforts from every summer. Over the past year, our students that led the Student SNAP chapter, and that's Students for a National Health Program, they organized and participated in multiple events this year, getting their classmates involved and really taking on some big projects, and I think you'll be impressed. They put together a presentation on single payer healthcare 101, and they had Senator John Marty come and speak with the group. They had over 100 medical students, nursing students, dental students, and physical therapy, occupational therapy students attend. They organized a rally to save the hospital. It was a rally that drew medical students, physicians, and nurses to oppose the Fairview-Sanford merger. They actively participated in alterations to the current medical school curriculum. They held meetings with lawmakers. They organized a Pack the Senate in City Hall events numerous times during the legislative session. They put together panel events with students and national speakers. They really made amazing things happen, and we are looking forward to all the things that our interns from this summer will be doing over the next year. We will be updating you on their projects, how you can get involved, how you can support these students in their education. And I mentioned big news, big things happening. So the SNAP chapter, the Students for a National Health Program, a few years ago, you may have heard that they participated in a die-in. It was a rally at the AMA's national conference, and they single-handedly got the AMA, the American Medical Association, to turn away from a dark money lobbying group called the Partnership for America's Healthcare Future, which is a very fancy sounding name for people who oppose single payer. And so several years ago, they had this breakthrough, and today they, medical students from across the nation signed up to join the AMA, and they brought to the AMA a resolution to get them to officially remove any formal opposition to single payer healthcare reform. And their resolution passed unanimously. Oh, goosebumps. So big round of applause for our future physicians. They are our energy, they are our future, and they are inspiring to all of us. And so another great feat today. So look for it on social media. Yes, Dave, it's awesome. So we will be sharing more about that on social media and in our newsletters and future postings. So excited to share good news with everyone, and thank you so much for joining us tonight.
Thank you, Jen. That is really a breakthrough. I'm very excited. Okay, now we're going to have to get them to come out in official support of single payer funding. But hey, removing opposition is good. First time in about 150 years, right? Okay. Thank you, Jen. Next up, Rose is going to talk about, I'll take my slides down and Rose is going to put hers up. She's going to talk about the recently ended 2023 legislative session. And hint, you might not have heard a lot about it in the news because a lot of other things that were really super exciting and important for progressives did capture the news. But on the healthcare policy and front, it's more than you think. So looking forward to hearing this.
All right, thanks, Anne. Once you take your slides down, I will put mine up and
There we go.
all right, let's see if I can make this work now. Give me a second, everyone. It always takes a minute for me to figure out. There we go. Share screen. Okay. Oops, nope. First I got to do this. That's right. And then this. All right, now let's hope this works. Are you all seeing? That's not the one I wanted. That's not the first one. Didn't start from the beginning for some odd reason. So let's giving you a sneak peek, I guess. Let's get back to the front. Are you seeing just the main slide, Judy? There's no notes on there or anything?
No, the notes are back.
Okay.
again.
We were having a little technical difficulty earlier, everyone. So just wanted to make sure you were seeing what I'm seeing here. So, all right, here we go. A little bit of a recap of what happened in this legislative session. So I want to first sort of set the stage again by reminding everyone that last December, Healthcare for All Minnesota sent a letter to the Minnesota Senate and House leadership, as well as the chairs of the Senate and House Health Committees and the Minnesota Health Plan Caucus leadership. We outlined our proposals for legislative priorities in relation to healthcare reform legislation, because we really felt that it was important to let the legislature know where the movement was at and not wait for them to tell us where they're at. And especially when it comes to moving legislation that will begin to sort of unravel this very convoluted, costly system and move us closer to the Minnesota Health Plan. So presenting these priority proposals proved to be a pretty successful model, as House Health Policy and Financing Chair Tina Liebling reached out after receiving the letter and asked to meet with myself and Dr. Bracke to review those priorities. And the Chair Liebling was very interested in what we had outlined. And as you will see, as I go through this legislative session recap, through her leadership and that of other Minnesota Health Plan leaders, a significant number of our priorities were indeed included in the final omnibus health bill in some way, shape, or form. So you can see here, we asked to have informational hearings on the Minnesota Health Plan. We wanted to make sure that we finally got a cost study analysis done of the Minnesota Health Plan compared to the current health system. We want to deprivatize, right? We want to deprivatize our public health programs. We want to expand coverage, and the first thing in which to do that is to cover undocumented families and friends and neighbors, and then do some health insurance industry regulations, as well as some pharmaceutical drug, industry regulations. So those are the priorities we sent to those leaders. So the next thing I want to say before I dive into what we ended up getting and what we didn't is to just remind everyone that, lots of things get proposed in healthcare reform all the time in every session, it seems. And we want to be very, very careful and very strategic about what we support, lend our support to. If we really felt strongly against something, we want to be able to quantify why that is with resources. Making sure that it's all grounded in the fact that we are always looking to move closer to the Minnesota Health Plan. So here is some of the criteria that we use at Healthcare for All Minnesota when we hear about these proposals that are coming forward on various healthcare reform legislation. We want to make sure that it lowers or eliminates administrative costs. This is key, right? That's the savings we get to be able to make sure everyone's got healthcare. Reduce, eliminate the influence of the private insurance and the private sector altogether. Help build the administrative structure that we're going to need to implement a public plan that we're all covered by. Have meaningful increases in the number of people who are actually covered by this next step that we're going to take. We want it obviously to be more affordable and remove any of the barriers of cost that exist now. We want there to be freedom of choice of providers and hospitals. We want the coverage to be comprehensive. We want cost containment authority and provisions to be put and included in any of that legislation. And we want to avoid all of the failed strategies that everybody has been trying for the last literally 50 years that have done nothing but actually increase costs, increase health, especially racial health disparities, and do nothing to actually get quality improved and cost under control. Things like the value-based purchasing and the ACOs and HMOs and prior authorizations and denials and formularies for, drug medications. None of that stuff is necessary. That's all business strategies, not healthcare strategies. So we want to make sure none of that's included in any of the legislation that we're looking at when we're actually trying to improve the system and make steps forward. So with that in mind, the Minnesota Health Plan itself, what we got accomplished, probably the most important thing, we are getting that study done, everybody. This is a huge, huge win for us. We finally got that approval and the funding for a study that will specifically compare the Minnesota Health Plan to our current system to give us a total cost of what the Minnesota Health Plan would cost to implement. With that information, we can then begin to peel back that overall cost onion and determine how we ultimately fund the system, meaning how much will an individual or a family pay? How much will employers pay? How much would the government pay? Although, we weren't able to secure the informational hearings on the MHP in the committee the various committees of jurisdiction we were hoping for this session, we are focusing now on making that happen between now and the next session out in the communities, but also during the 2024 session. They can hold hearings outside of the actual session itself, if they're informational hearings. So we still have some opportunities and ways for us to be engaged. But this study is huge, and they allocated $2.8 million to get this study done. So we have to stay engaged and make sure that the study goes forward, and we are influencing the powers that be that are going to be working on this study. So this is very exciting news, very, very exciting. Primary care case management is really just moving to a direct contracting model between the state and the providers under our public health programs, such as Medicaid, which is known as Minnesota Assistance, and also in our Minnesota Care program. Well, although the specific primary care case management bill that Senator Marty authored itself didn't get passed, the bones of the bill were captured in the Health Omnibus Bill by directing the Department of Human Services to present a plan by January 15th of 2026 that reflects how much the state would save if we deprivatized our public health programs, as I said, medical assistance and MinCare. This is a pretty significant step forward in building the MHP infrastructure that we're going to need. And we want to make sure that the MHP to be a truly public healthcare system without those greedy corporate healthcare interferers. So this is why it's really important that we begin to deprivatize our current public programs in order to actually make that happen. So this wasn't quite as strong as we would have liked for it to be, but it's a really important step, and I'm really proud of the leadership that got this much done. I think we have some opportunity here to really amp this up going forward. I should also state, I might have it in a different slide, but I don't want to forget to state that a very important bill that was called the Freedom of Choice Bill, specifically for Minnesota Assistance Medicaid enrollees to be able to opt out of managed care plans and into direct contracting, so fee for service, was made it all the way through, almost passed, and then at the last minute it got pulled and it got more put into a framing of kind of a study to look into it. I think I do talk about this a little bit later, so I'll explain what happened there and what we're going to be working on to see if we can correct that and reinitiate that particular bill for the 2024 legislative session. Super, super important piece of legislation that was passed as it begins to really quantify that everybody is in, nobody is out. And when we mean all, we mean all. So what happened is the undocumented non-citizens, as it states in the law, as it's currently written, they are all going to be eligible regardless of age to participate in the Minnesota Care program if they are eligible via everybody's everybody else's eligibility requirements, which is basically income-based for Minnesota Care, right? So this is so important. It demonstrates a renewed commitment in my mind to our common humanity, as well as to our public's health. So this was a very, very big deal. So on health insurance regulation, we did accomplish some coverage requirements and limiting of out-of-pocket costs. They were specific to the Medicaid reform that happened in the medical assistance program, Minnesota Assistance. And so there now is no cost sharing for Medicaid patients. Children ages 0 to 6 stay on during that time, regardless of the parent's income level. And children and young adults ages 6 to 21 only have to file an annual reporting on where things are at in regards to their income, so that they don't have to be burdened with doing these eligibility determinations on a quarterly basis, which becomes incredibly cumbersome, both on the side of the state government, as well as, of course, a huge burden on families who are just trying to do better and succeed and survive and make sure that their children have access to health care. So this is also an important gain that we were able to make. We did not accomplish any kind of specific rate regulation on the insurance companies, but can't get it all, right? At least we got something. On the pharmaceuticals, Healthcare for All Minnesota recommendations for legislation that was related to pharmaceutical drugs was taken directly from the report of Attorney General Ellison's Lowering Pharmaceutical Drug Prices Task Force that I was honored to be appointed to serve on a couple of years ago. And although we would have liked to see stronger regulation around price gouging, we are hopeful that the Prescription Drug Affordability Board that can set upper payment limits for drugs and will be enforced through the AG's office will begin to deal with the unconscionable price gouging and greed that happens within this industry. So we're cautiously optimistic. We had hoped also for some really building on the good legislation that was passed in 2019 around regulating pharmacy benefit managers, but that didn't get done this session. But again, there's always hope for the future on this, because we did at least get some things done around pharmaceutical drugs. Some additional good things that happened this legislative session are interesting, just to note and remind everyone that, Healthcare for All Minnesota did endorse the cumulative impacts legislation that put power into the communities when it comes to giving permits for polluting facilities that we all know cause health problems like asthma in nearby residents. This is absolutely connected to environmental racism. We supported that bill. It passed. One of our major partners is Copal. They were tantamount to getting this legislation passed and are now very involved in the work going on behind the scenes to make sure that the community, in fact, is engaged in this work going forward. There was the creation of a Center for Healthcare Affordability. They're to be located in the Minnesota Department of Health. They're charged with finding ways to reduce administrative waste and enhance high-value care. We're particularly interested in the fact that finally the legislature has said, let's look at waste in the system, and as it's focused on administration, because we know where there is a lot of that. So we're very excited about that. They're an actuarial and economic analysis for a public option. The implementation and waiver process is also included in that. Charging the Department of Human Services with proposing legislation to implement a public option through the Minnesota Care Program effective in January of 2027. And they must contract with one or more actuarial firms to help develop the plan. So it'll be interesting to see what all goes into this. We have some thoughts about how we can be engaged in some of this work, so more to come on that in a moment. There's going to be a health subcommittee that's going to have the Commissioners of Human Services, Commissioner of Health, Commerce, and Management and Budget, and the Executive Director of MNsure. And they are charged with looking at ways to reduce administrative spending. Again, administrative waste, this is good. And low value care, their report is due in March of 2025. There is a creation of a Department of Children, Youth, and Families. This is good because it takes some of this off of DHS and puts it into a very specific create a department that can really put a focus on that work and the needs of children, youth, and families. So that also is important. As I said earlier, the Keeping the Nurses at the Bedside Act, the final bill does provide for loan forgiveness for nursing education, childcare support, violence prevention, and a study of nurse attrition. But that being said, as I had said earlier, I know people have joined since then, but the fact that our nurses did not get a voice in staffing decisions is nothing short of shameful. Nowhere during this session was the power of corporate healthcare more insidious than it was in this particular instance. Shame, shame, shame on Mayo, the legislature, and the governor for failing our nurses and thereby their ability to provide patients with safe patient care. There was some emergency aid for nursing homes in the bonding bill, $300 million over 4 years. This is also a very important thing. And of course, paid family and medical leave, granting Minnesotans paid leave to be able to care for themselves and the people they love, as well as earned and safe and sick time. All of these things are social determinants of health and are very, very important, obviously, to healthcare overall. I want to mention that there was a proposal for a healthcare affordability board, and HCAM actually wrote a letter to the conference committee that was looking at the omnibus health bill, expressing our concerns about that particular healthcare affordability board. It was really based on the fact that it was very wishy-washy. It had a lot of that value-based payment language in it. It was so esoteric and sort of out there. We were very concerned that it could take us down a negative path going where we all want to go, which is healthcare justice, and that means the Minnesota Health Plan. So we drafted a letter and proposed some other ideas for the legislature to focus on instead of this healthcare affordability board that seemed far too vague and sort of fluffy. And the board didn't get passed. They didn't actually pass the healthcare affordability board. They did, however, pass this subcabinet and then the Center for Healthcare Affordability. But there are ways for us to influence the work of both of those committees. So there is hope for us to have an opportunity to sort of get in with them and give public comment and help shape what those reports and those studies are going to look like. I want to just switch over for a second to the national scene, because I was honored for the first time in my career to have been in Washington, D.C. for the introduction of the Medicare for All bills, both in the House and the Senate. The first time the bills were actually introduced bicamerally in both houses at the same exact time on the same day. And that was on May 17th, 2023. There was Senator Sanders held a town hall meeting the night before, and it was specifically aimed at our healthcare providers. So there were doctors and nurses that served on the panel talking about their vision for healthcare in the future and how awful this system really is to practice under. It was really empowering and a wonderful way to set up the stage for the introduction of the bills. The bill was introduced with the highest number in the House of co-sponsors ever, 113. Minnesota representatives, co-sponsors were Betty McCollum in CD4 and Ilhan Omar in CD5. There were 14 Senate co-authors. Neither Senator Klobuchar or Senator Smith are co-sponsors. So we really have, as exciting as it is, and it's good to have the bills introduced, I would argue that we have to concentrate on creating the conditions to make Medicare for All possible. And the first thing we have to do is save Medicare from privatization. We have got to get Medicare Advantage out of Medicare, as well as ACO REACH and all of this nonsense with the private equity in Wall Street literally taking over our Medicare. Who wants Medicare for All if it's just another privatized, healthcare plan, right? So that is going to be a major focus for us. And I am honored as the national coordinator of the labor campaign for single payer to be having some conversations about creating a national conference, a table that would begin to put together an actual strategic plan for the nation that we can all be working together to save Medicare, deprivatize it, and actually, as I say, create the conditions we need to make Medicare for All possible within the next decade. So in the final analysis, hey, I mean, overall, we did good with, like I've said, the exception of what happened to our nurses. Some good things did get passed. There's no question about that. We built important infrastructure for future implementation of the Minnesota Health Plan. But boy, oh boy, we really did see corporate healthcare expose themselves for the greedy beasts that they are. And it really just lets us know that we need that full-blown campaign and strategy to slay those beasts before they end up slaying us. So ways in which to stay engaged. These are the 5 areas in that omnibus bill that we believe, and the board has agreed this just at the meeting this morning for HCAM, that there are ways for us to really look at these as opportunities for our continued involvement when it comes to influencing these 5 programs or studies. The HCAM board, as I said, will be thinking about what that means and how that will shape the work going forward. But I want to note that a very important piece of legislation that we supported, this is where I got off script a little bit earlier, but that Freedom of Choice Act, the reason that was given at the last minute, why that was changed from just happening, where Medicaid enrollees could choose between managed care or direct contracting fee for service, which opens them up to many more provider choices, by the way. The reason it apparently didn't get done at the last minute had to do with a federal drug program. It's called the 340B drug program, and it allows for some deep discounts on medications for facilities and providers that actually take care of a certain population of patients, mostly Medicaid patients, as well as the uninsured, the working poor. And it is a really good program, everybody. It's a very, very good and important federal program. I don't think that I'm confused. I can't figure out why it has anything to do with the idea of allowing recipients to choose whether they want to have either managed care or they would rather go to direct contracting. It literally says on I can't remember if it's MDH or DHS's website that the 340B program applies whichever of those 2 you choose. So in order to get this all figured out and get it straight, I've scheduled a meeting for a week, the week after next with Senator Marty, and we're going to meet with Dr. Steven Schandelmeyer, who is at the School of Pharmacy over at the University of Minnesota. And Dr. Schandelmeyer also served on A.G. Ellison's task force with me. He's brilliant. He is an expert in this field. So I'm going to find out whether or not there's any there, because if there is, then we got to figure out what the game plan is, right? To move forward on this and still get it done, but not impact that program. And if it isn't, then we need to get a meeting with Senator Wickland and some of the leaders who bought into this and let them know actually it's not a problem and they need to redo this in the 2024 session and just pass the Freedom of Choice Act. So we will be working on that over the next few weeks as well. So more to come. So I will wrap it up by just saying that it is time. As I said earlier, we need a full-blown strategic campaign plan if we're going to win the Minnesota Health Plan. As you know, HCAM has been the engine for bringing together the Health Justice Allies Coalition, which consists of labor unions, community and rural organizations, as well as small businesses, all of whom support the Minnesota Health Plan as the fix to our broken system. The Health Justice Allies Coalition is going to be meeting in late July, early August to review, discuss, and hopefully adopt a statewide campaign that will specifically assign tasks to each of the coalition partners and ask for their commitment of organizational resources to the campaign. Needless to say, each and every one of you will be a critical part of that campaign as well. So please watch for more information on how you can help as we solidify and roll out this important next step in our quest for healthcare justice for all. And with that, I'm going to at least stop sharing the slides and we can move to any sort of Q&A that folks may have.
Thanks so much, Rose. That was an amazing presentation.
Thank you.
And we do have our work cut out for us. We made this a meeting this evening so that we could see everybody who was with us. I would invite you to turn on your screens so we can be together this evening at this meeting. So I would invite everyone to turn on their screens and then use the raised hand function for questions. And I think maybe Judy, Jen, and I
Yeah, I
can
will
watch
call
to
on
see.
people.
Okay.
I just see that, is it Lana? And you asked about when do we expect us to get the results of the study? The study, which study? There's so many studies. Are you talking about the one with the Minnesota Health Plan compared to the current system? Because if that's the study you're talking about, I believe that one is due in 2026. And the beginnings of DHS and MDH presenting to the legislature how they could look at implementing a public option by January of 2027 is actually due to the legislature in February of 2024. So that's the first one up. And I'm really, really anxious to sit down with some of the authors and some of the organizations that really worked hard for the public option, because we still continue to have a number of questions that we would like to ask and understand better how this is going to work, who it's going to cover, what's it going to cost, what's it going to cost individuals, et cetera, et cetera. And so we're hoping we can get some of those answers over the next month or two.
Thank you.
Sure.
I might just recognize this evening, Rose, Sharon Schmidt is at our meeting this evening,
Yes.
and she was really the driver with health policy advocates of that freedom to choose bill.
Yes. Yes,
Rose,
correct.
Sharon, you are hats off to you for that work. And it's not over.
No, not by any means. And we took a support position on that. Healthcare for All Minnesota did as well. So we agree it's important. Sharon, do you want to say anything more about that? I mean, we've got work to do between now and next session, but I really want to dig into that and see if we can't figure out how to still make that happen.
Yes, we've already got plans. We'll be meeting with some of the leaders, just to find out how we can prevent this from happening again, because you're right. That 34B, 40B had nothing to do with anything, but
I don't think so.
they just come in and state something.
Mm-hmm.
And so what we're trying to say is we have the answers. What are the questions? And I was proposing that we need to know, or at least have these people call us, or if they don't trust us, call someone they trust who would likely then get back to us, because we have most of the people that are aware of lots of things. So that's been my thoughts, but we're already working on it.
Excellent. Well, we're there with you. I'm going to be, like I said, I'm going to get more information on this 340B drug program, because I don't think it does have anything to do with it. So we'll go to an expert. And if we find out wrong and there's something we've got to do to make sure we protect that program, that doesn't mean we still can't move on the other piece of this, right? We just got to figure out how they interact with each other, and then, how we figure out the loophole. That's all. So
Exactly.
Yes, I very much appreciate your work on this.
Yes, and Diane Peterson probably did more work than I did this year, because I haven't been the healthiest, but I did do as much as I could do. But she did most of the writing, and she is absolutely excellent when it comes to synthesizing information and getting it on a sheet.
Absolutely. Couldn't agree more. No, we had a good partnership on that this year for sure. And we'll continue that.
Thank you.
Matthews, any recent progress nationally against ACO REACH? Well, so there was a little bit of a crimp put into ACO REACH through Biden, which was a bit of a victory. They managed to peel some of it back because of the pressures of the industry. So I know that Representative Jayapal, and again, with the work I'm doing on a national level, I'm really very lucky because I'm at a bunch of national tables and I've got some contacts inside of both Jayapal as well as Bernie Sanders' office now. And for Representative Jayapal, she is putting together, and she's getting a lot of congressional support on this, a plea to the Biden administration, because it doesn't necessarily require congressional action. Biden could, through executive order, because it's through CMS, right, which is an agency under his administration, could start to do some things. They want to put a focus. This is where they're starting, because so many seniors are on Medicare Advantage. And I'm just going to switch over to Medicare Advantage for a minute and away from ACO REACH, but that we're probably not, if we go in and say, just do away with that program, it's probably not going to go anywhere. So instead, the strategy they're using is to say, there's a ton of financial fraud and abuse that is happening inside of that Medicare Advantage program, and we can prove it. So let's stop that. Let's take the money that is being spent in the fraud and abuse, and let's do some things like, oh, I don't know, cap out-of-pocket costs for seniors on traditional Medicare. How about we expand Medicare to cover dental and vision, because hearing is now, I think, going to be covered under the most recent Inflation Reduction Act. How about we start to drop the age from 65 to 60, right? We can, those are good incremental steps, because those are things that lead us towards all of us eventually being in a Medicare for all type of a plan. I think it's really I think it's the right thing. I think it's a brilliant strategy to do it. And it's pretty hard for fiscal conservatives to argue that this is a bad idea when there is so much evidence in the courts, no less, that show how we are being ripped off by these insurance companies in our Medicare program. So between the ACO REACH, which I think has had something of, I think it's been dampened. I don't know if it's been completely wiped out, but I know that there has been a bit of a win on the ACO REACH stuff. And I'm not sure whether Jen or any of the PNHP folks here could do a better job of sort of talking about where that's at, because PNHP really has been lead on this nationally without a doubt. But I do know that some of the really good work going on around Medicare Advantage is something we should all be thinking about pitching in on, for sure. Jen, do you have anything on ACO REACH you want to add? Just, I'll ask you first, and then I'll go to you, Linda, with the question.
Sure. Yes, we did have a bit of a victory this year. So they have stopped enrolling new beneficiaries into ACO REACH.
That's what it was.
So
thank you.
The program has been halted. It has not been pulled back. So people are still in it. However, there are no more people that are being enrolled without their knowledge. So that was a win. Yes.
Perfect. Thank you. I just couldn't remember the specifics, but I knew that small victory, but a victory, important victory nonetheless. And Lana, thank you. You are exactly right. In both the bill, Bernie's bill, as well as in Pramila's bill, there's a whole section that talks about a transition period, because literally if they passed Medicare for all today, we wouldn't be on Medicare for all tomorrow. It's going to take a little bit of time to transition the system. And all of those bills talk about during the transition, you're right, we go from 60 to 65, 65 to 55. And then 65 to 60, 60 to 55, et cetera, and from 0 to 18, and then even compress it from the bottom up, right?
Mm-hmm.
And then expand it, all of that kind of stuff. And those are all good things. So heck, why not start doing that outside of the legislation being passed? Even better if we can get those things in place, then we have less to do when we actually pass Medicare for all, right? So that's a very good strategy for us to think about at the state level, as well as on the national level. And that is why we're fighting for deprivatization of our state programs, this cost study, more regulation of the industry. All of that stuff leads us to the pathway to where we want to be, which is the Minnesota Health Plan. So Linda, go ahead.
Yeah. Well, first off, thank you, Rose, for the good work that you do and the leadership that you provide, and to everybody else that's here. It's really, it's our time to bring about the change that we so need. So I at my old age, I'm taking some college courses, and I completed a research paper that I did about Medicare. I started out about the privatization that's under the radar and had to turn the paper into the history of healthcare in the United States. But the point of it is I learned so much about Medicare Advantage versus traditional Medicare. And I did an informal survey just among people that I know, 25 people. I asked them just 5 questions. One of them was, do you know the difference between Medicare and Medicare Advantage? Only 2 of the 25 could tell me. So, so that tells, most people don't understand, and the system is so complex. Most people are reluctant to have a conversation because they don't want to look stupid. So that brings me to the letter that Senator Tina Smith wrote back to Ken McGinnis after he wrote to her. And her response was like, oh, so many Minnesotans are happy with their Medicare Advantage. And as I'm listening to that, I thought, she doesn't get it either.
No, she does.
We need, so when it's no surprise to me that Amy, Tina, Angie, that they haven't signed on to it because they don't get it. And I think that, I don't know how we go about doing that, but because you, Rose, are so succinct in how you present something, I think we should target them.
We are targeting, well, we aren't targeting Klobuchar at the moment. I just don't have a lot of hope for Amy. I'm sorry, but Tina, so HCAM has had a meeting with Tina's staff, the staff that actually specializes in senior issues. And so therefore Medicare, Social Security, things like that. It was, and I unfortunately was sick and I wasn't able to be at that meeting, but we have a commitment to have an ongoing meeting with them. We're bringing them all of these facts. Dr. Kip Sullivan is so brilliant on giving us the research, right? We're not just like pulling this stuff out of thin air. There's real research to support this stuff, right? We're providing the resources. We're giving them the arguments, and Ann was at the meeting, so Ann may want to just speak to this. But my understanding was it was a very productive meeting, and they very much appreciated getting that information. These like form letters that come out of these legislative offices are so frustrating because I'm telling you, some of that is driven by staff more than it is, in my mind, even the seated legislator. To some degree, and it gets so frustrating to me because it's like, no, you're not listening and at what's really going on. So we're trying to tackle it with Tina first from that perspective I was talking about. There's abuse going on. You don't want abuse to happen in the system. How can we start to tackle that together and then see if we can't use that as a jumping off point to continue those conversations with her and move her more towards eventually signing on to Medicare for all. So we are trying.
Yeah, I call her the quiet warrior of the Senate.
I mean, I like Tina personally. I've known her for a while. I have a good relationship with her. And I think that it's possible to move Tina on this. I don't think it's possible to move Klobuchar, but I do think it's possible to move Tina on this, but it's going to take some work.
Yeah.
No question about it. You bet.
Well, and actually, Linda, our coalition of our partner organizations helped with signing a letter highlighting the fraud, waste, and abuse, rampant fraud, and the fact that the Advantage programs and the commercial insurance industry is literally draining the Medicare trust fund. So what we're really trying to do is get our numbers to coalesce around making this message very clear, very powerful. And we're trying to also to brief our members and ask them to contact these members of Congress and say, they're kind of asleep at the switch and we need to hold them a little bit more accountable. They have been getting reports from the CBO, the Congressional Budget Office. And then we've now had whistleblower articles coming out in major media sources. And I would think it's about time for them to be a little bit embarrassed at not knowing what's going on right under their very noses, and allowing CMS to run kind of rampant and fail to do their duty to to provide oversight for this program.
Yeah.
We're learning more about how the industry has captured the agency, and we're going to try to uncover that and really shine a light on what's going on in this agency. And it happens in a lot of agencies. It happens in agriculture, it happens in fossil fuel industry, it happens in healthcare, it happens in banking. And time for us to hold our elected members accountable. So
yeah, and you know, there are a number of national organizations that we are working with, will continue to work with, who are doing this exposing of what's happening inside of the Medicare Advantage programs, getting seniors. But you know, there has now been just there's been some recent actual articles that have been published, like New York Times, you know, in pretty major newspapers, that say that there's just the number of senior citizens who are dealing with denials of care under Medicare Advantage because pre-authorizations, you know, denials and all this kind of stuff. We need to get that out into the public. And I mean, you know, what would be great is I see in the, you know, in the chat, somebody said, yeah, I just saw an ad with Joe Namath telling us how great, you know, they get the movie stars and the athletes, right, to tell us how wonderful Medicare Advantage is. Where are our movie stars, right? And our famous people saying, actually, no, it's not. It's not a good thing at all, right? And we do have to figure that piece out. I don't know if we got the jing to do it just yet. But at the very least, it takes those conversations with and those stories, and even be a hero. Any of you who know of Audie Barkan, who is, you know, a young man who is dying of ALS and is still an activist in this movement for healthcare justice. His organization is called Be a Hero. They have decided to prioritize right now this privatization of Medicare, and they're really working to get seniors to tell their story about this, and to get hearings in Congress so that this can be exposed and some of this can start to get dealt with. So fingers crossed that we're on a path, because it seems to be getting more attention now than it has in, prior to the last year and a half or so. I want to just answer, so can someone give info on how we expect more doctors, nurses, and nurse practitioners to be trained? Well, certainly, obviously, M&A is a premier organization that trains the nurses within their own organization, but they open up those types of trainings even to nurses who are not necessarily organized in the union. And it is nurse-on-nurse conversations. It's doctor-on-doctor conversations that really are so powerful when it comes to talking about the system as it currently is and how it's impacting you all's ability to practice, right, medicine. And I know Dr. Crossan from PNHP and I just talked the other day about how we've got to figure out how to do more infiltration, maybe through the student, Students for a National Health Program, getting in and doing what they would refer to as grand rounds in the hospitals, meaning they can literally do presentations for physicians on staff, as well as nurses, to come in and hear presentations about how this system is not allowing them to practice medicine anymore, right? So there's lots of ways in which I think this is happening, but more work needs to be done. Yeah, Anne, go ahead.
So, Lana, I wonder, I don't know if you're talking about understanding the economics of our current healthcare system, or if you're talking about workforce development. And I'll just point out that the Minnesota Health Plan, specifically, one of its 10 principles is to pay attention to workforce development, to make sure we have enough people in the pipeline. We know we're losing a lot of nurses and primary care physicians over the next few years. Right now, some of them are sort of experiencing so much burnout from our current system that we are having trouble retaining, but we do need more people in the pipeline. Once we actually insure everybody and assure that everyone can get the care, can afford to go to a physician, nurse practitioner, PA, we will need more providers. So there is a provision in the Minnesota Health Plan to make sure that workforce development gets attention. It's not just an accident, that we're just lucky if enough people. We need to be recruiting healthcare workers.
Yes, that's exactly right. And Matthews, getting major donors to pitch priorities to Senator Smith, labor leaders maybe who endorsed her. I think I think that you're right about that. And let me say something about the labor component since I come out of labor. Here's the frustrating thing in the labor movement. Guess what? The National AFL-CIO is in partnership with the AARP in promoting Medicare Advantage plans to trade unionists, retirees. So you see how this craziness all gets intertwined together. And so one thing I'm thinking about, again, in my role as the national coordinator for the labor campaign for single payer, is I am going to be reaching out, and I know Mike Madden is on here. Michael, you and I need to have a conversation about this along with Ken McInnes. I think that we should sit down and think about how to approach President Burnham, because she is the president of the Minnesota AFL-CIO. She happens to also be on the executive council. She's an executive vice president of the national AFL-CIO, to bring this to her and say, people probably don't even realize necessarily that this is going on. This is not a good thing, and labor should not be promoting the privatization of our Medicare program. That should just not be part of the deal. So we have to think strategically about that, because I have no doubt that there's some money involved in all of that as well. So we do have to think about that, but I am taking that on to tackle it. And as I say, you are correct. If we could start to have that conversation inside the House of Labor, and maybe if we can start with that conversation with President Burnham, and then maybe do some education of the various entities here in Minnesota. I'd love to start with the Minnesota ARA and then the Minnesota Retirees Council. We can start to do the education on the retirees, push it out and push it up, and then keep going to see what we can do about involvement of labor in this fight as well. So I see a hand up by Hillary. Go ahead, Hillary.
Yeah, I was going to say, when I was at the Capitol just a few weeks ago, I ran into Denise Specht, and I belong to ER Minnesota, Education Minnesota. Yeah. And I've never really met her before, but I went up to her and talked to her, and I said to her, I asked her if she realized that when they do the retirement stuff and talk to retiring educators about, about health insurance, I mean, the supplement or advantage, what they really do is present advantage. And they have a little bit of information about, they have a separate, supplemental, the regular,
the gap plans.
a little bit, but they hardly talk about that at all. They only talk really about advantage. So I asked her if she realized that, and that actually Advantage is privatizing Medicare, and she didn't know anything about it.
So here's
she believes in Medicare for all.
Yeah, I know she does,
but she doesn't know what she's doing.
Right. So here, I thank you for mentioning this, Hillary, and here's why. On my list of to-dos, literally, I think for next Monday, because I wanted to give Denise a little breathing space because all the schools are just starting, to end the school year. I ran into her up at the Capitol as well a few months ago, and she said, oh my God, Rose, I need to bring you in. We've got to talk about doing more work around the Minnesota Health Plan and single payer, because our teachers and our members in admin are suffering. And it's getting worse and worse. It's becoming the issue at the bargaining table. People are paying a ton of money out of pocket for these premiums. The districts can't afford it. We have got to get serious about really looking at the big picture fix. So I told her I would wait until after the school session and the legislative sessions were done. And then her and I are going to go to lunch, and we're going to talk about a game plan. She wants to bring me in to do a presentation to the executive board and to talk also to, I think they have like an insurance committee or something that just helps the various bargaining units negotiate, health benefits. So she thought that might be a really good place to do that conversation. And particularly because I'm a former negotiator that negotiated, health insurance benefits. So I'm glad to know that Denise, who also sits on the executive council of the Minnesota State AFL-CIO, maybe needs some help in understanding the difference between Medicare and Medicare Advantage. I'll put that into my pitch when I talk to her and tell her that I'm happy to throw that into my education piece for the executive board and the members of Education Minnesota.
And usually teachers could afford, retiring teachers have they have Social Security, plus they have their retirement. they could afford to pay for the regular Medigap.
Yes.
They
right,
could afford it.
Right. Yeah.
So I
I
think
hear
it's
ya.
really important to get that component of people. I also wanted to say something when Ann was talking about burnout. I had listened on, must have been Facebook, Dr. Z a few times. I don't know if you've ever run across him,
Yep.
but he doesn't talk
Z-Dog
about
Man.
it as burnout. He talks about it as moral injury.
Injury. That's right.
And I
Yes.
think people should talk about that. That sounds way worse.
Mhm.
Yes, that's, yeah, there was just a recent thing published on, burning out is one piece of it, is just getting tired, right? Burning out can be just tired because you're being asked to do so much, but the burnout or the moral injury comes from the fact that you know what the problem is and you tell the higher ups, here's what we need to fix it. And they basically say, yeah, no thanks, just go and figure it out for yourselves. That then becomes a real issue of moral injury because the providers are no longer able to do what is in their nature and what they're taught, which is to heal. They can't do that anymore. And that becomes the fight and the tug of war. And it's very serious, you guys. We are losing a ton of bedside nurses and physicians who are just like, forget it. It ain't worth it. They're scared to death. That somebody's going to die on their watch, right? Because they couldn't get to them fast enough because there aren't enough of them, not because of their incompetence or anything. There just aren't enough of them to handle the level of acuity of patient needs in the hospital. So I think we are probably at the end of the Q&A. You all are putting some really terrific things in there. And Mike, I think that's from you about President Burnham. So thank you for that. I will take that under consideration and I will reach out to both you and Ken and we'll see if we can't put together a game plan to maybe go in and book a meeting with Bernie. But thanks everyone. I hope this was helpful. You have put some great ideas in and some thoughts and perspectives, especially on this Medicare Advantage stuff. I really do think that's speaking to people. And I think that we have got an event coming up in July that will also kind of center that because guess what? It's the birthday of Medicare. So more to come on that. But thank you everyone so much. I hope this was helpful.
Okay, can you all see my slide? We're gonna finish up with what's coming up, what's happening next, and how you can fit into this our work going forward, because it's going to take all of us. It's going to take an army of ordinary people to push back against the big money, the ideological barriers we face, and the fear of change. There's a little bit of fear, even as bad as the current system is, there's a fear of, diving into the pool, but as long as we all get in the pool together. So I want to give you some opportunities to help out with this work. You heard that we do need resources. So that's always helpful. We've got a lot of things coming up this summer. We are going to be tabling at Woodbury at Juneteenth, in Woodbury and Minneapolis on June 17th, and then in Maple Grove on June 19th. We're some of us are going down to Redwood Falls. Oh, I got that wrong. I am really sorry. This is Red Lake Falls. I'm sorry, Red Lake Falls and Polk County. I'll correct that before we send the slides out. We're going up to Red Lake Falls, Polk County. We got an invitation from the DFL to speak, and they are actually creating a whole event around this and inviting DFLers from Red Lake Falls and Polk County to come and listen to hear about single payer financing for healthcare and what they can do to help, and also the outcome of the legislative session. So I'm so thankful to Rose for putting all that information together, because that's going to help me out a lot. Cheryl Quick and I are going to drive up. It's going to be 5 hours. We're going to get a tour of northwestern Minnesota. And looking forward to that. That's June 22nd. June 24th and 25th. Oh, there's another one. 24th and 25th, the weekend of 24th and 25th is the Twin Cities Pride Festival in Loring Park. We're getting some volunteers, but anyone on this call this evening, feel free to go ahead and volunteer. We'd like to have at least 6, 7, 8 people each shift. It's going to be, we have to staff that booth from 10 a.m. to 7 p.m. on Saturday, 10 a.m. to 6 p.m. on Sunday. They're expecting a really big event this year. I mean, we talked to hundreds of people at the Twin Cities Pride Festival. It's really a worthwhile volunteer effort. So let Judy, Jen, or me know if you can join us for any amount of time for that event. It is actually really very rewarding to talk to people at this event about healthcare and their needs and what we can do to fix it. Save the date. Rose mentioned that we're going to celebrate the birthday of Medicare. It's actually July 30th, but Dave Garibaldi and other volunteers have reserved the Southdale Library in Edina for an event, and speakers and guests are being worked on. So save the date for that. August 1st, 2nd, and 3rd, we're going down to Redwood Falls for Farm Fest. Last year was our first year. We spent 3 days at Farm Fest, and that was a really great experience. That's an opportunity for us again to get out to Greater Minnesota and talk to people about farmers, small business owners. Rural Minnesota really, really, really needs healthcare, needs us to fix how we pay for healthcare, and we need them to join us in this fight. So, and then for the 2nd year in a row, we are going to be at the Minnesota State Fair in the education booth all 12 days of the Great Minnesota State Fair. It takes a lot of volunteers to pull this off. So anyone who can help with that, we will be looking for volunteers toward the end of summer. Other things will come up, and we have great volunteers in Mankato, Duluth, and other parts of the state working on tabling at county fairs, at farmers markets, at pride festivals and parades in their local area. So if you we'll put some stuff on our calendar. I think we're going to try to come up with a table of events so that it's easier to see what's available and what's scheduled. We need you to suggest events we should cover. Where should we be? Where should we be reaching out? And this is all organizing and building our base of support for this movement. So I've got a website up for you to write to volunteer. And then, of course, always continue to write and respond to action alerts. We do need to put a little pressure on our elected officials in a lot of areas, whether it's the Medicare Advantage scams or, fixing this broken healthcare payment system. I'll throw up a slide just on social media. We need your help to spread our message. One of the least expensive ways to spread our message is via our social media sites and channels. And also, if you want to go back and look at some training events that we've done, everything is recorded and available to look at on our YouTube channel and available to share with other people who you're trying to talk to about this issue. Lots of good information on websites. I'll always highlight the book that Senator Marty wrote about the Minnesota Health Plan. It's a really good explanation, 140 pages, easy to read. I call it a page turner. Go ahead and take a look at it. And it's available electronically on the site called mnhealthplan.org. The site is right up there. And other useful websites and newsletters. I'll mention a couple things that are kind of new. Healthcare Uncovered is a new, I'd say, I don't know if you call it a newsletter or column by Wendell Potter, who's the whistleblower for the commercial insurance industry. He is posting a lot of really rather shocking information about the for-profit side of healthcare. So that's a good one to sign up for. Another one is the Health Justice Monitor. I put the email address up for that one. In case you don't have enough stuff coming into your inbox, go ahead and sign up for more. And then our last thing is a call to action. And our call to action this evening is to volunteer for an event, suggest or plan an event, donate to support the ongoing work of Healthcare for All Minnesota and Physicians for a National Health Program Minnesota to help us fund expenses for our summer events and the ongoing work of our two organizations. This is a quick list if you want to scan it for other things we can do as we work to organize and build our base of support for this work. And it's all about building the political will that we need to pass and implement healthcare finance reform. Hillary, before I go to my last slide, did you have a question? Do you want to unmute?
I'm stuck.
Sorry, I couldn't get to the spot. I wanted to say, just because we're talking about money and finance and we're talking about social media, that for every person that's on Facebook, you can set up for your birthday, you can set up a fundraiser. Well, there's not a fundraiser for HCA-MN Minnesota or for PNHP Minnesota. I did it not last year. I did it for Doctors Without Borders, but the year before that, I did it for PNHP, but it was national, and I think it was like $500 or something that went to national. And I looked this time again, and because it's my birthday this week, and nope, there's nothing for our two main agencies or groups. So I just want to say that that's something that we should do.
Okay, maybe you could get with Judy and Jen and explain.
There's a lot of rules surrounding that. And so we haven't been able to collect donations online previously due to those Facebook rules, because we're not just a 501c3, we're a 501c4 as well. And our Facebook page was started under our 501c4 status. And they don't allow donations via Facebook because of that status. So, but that doesn't change the fact that you could make a post and then copy and paste the link and put it in and say, this is what I want for my birthday. So you could do it individually, but it just wouldn't be using that feature on Facebook.
Okay.
So then people would just click on to donating for HCA-MN or whatever.
Send them to our donation.
Yeah,
page.
you can put a little spiel and say, I support this organization and these are the reasons I support it. Click the link below to donate to them, because this would be the most meaningful gift you could give to me, or something like that.
Okay, this is my final slide. This is our reminder to defend and expand these important public health insurance programs. Medicare and Medicaid, the Medicare and Medicaid law was passed and signed into law by President Lyndon Johnson on July 30th, 1965. It's 58 years old this year, so we will be supporting, and one day we will support the birthday of Medicare for all. All right, my contact information, and then any wrap up, Judy or Jen?
Apologies, my computer decided to have pop-ups happen. Yes, for the just brief wrap up again, we will upload the link for this meeting to YouTube, as well as send out the slides. So please look for that. Please also look for our posts on Facebook and Instagram regarding the summer events and fundraising for that. And please like and share those, because the more people who like and share it, even if you don't donate or can't donate for whatever reason, if you like and share it, the more people will see it. And that actually really does help us out. And yeah, I think that's it. Thank you again, everyone, for attending tonight's meeting. And we hope you guys we're taking a little break for the summer for educational events, because we're doing so many outreach events and focusing mostly on that. So we'll see everyone back in September. But we do hope that we connect with you over the summer at our outreach events, and otherwise wish you guys a wonderful summer. Linda, did you have a question?
Oh, if you could clarify, the party for Medicare, is it the 29th or the 30th?
It's the 29th.
Saturday, the 29th. Yeah. Just save the date. We'll send details out on that.
I was just going to say, we'll get flyers made up and make sure everybody gets all of the details.
Yes, we'll still have our newsletters going out, and we will also send some updates about events individually as well throughout the summer. That stuff is not ending, just the educational meetings on Thursday night. Thank you again, everyone. Have a great evening.
Thanks, everyone. Bye-bye.